First of all, I would like to ask for your permission to use this video for educational purpose and on internet. Do I have your permission?
Sure.
Yes.
So tell me, you had for many years before the surgery back pain and pain going down the leg. Can you tell me a little about how bad it was and how long you had that pain?
It was for a very long time, and toward the end, the pain got. I couldn't feel anything where I was walking anymore. My legs were numb, my feet were numb,
And you were falling.
and I was falling a lot.
Okay, you start losing even function. And we maximized conservative therapy, and then we did even a discogram. And discogram proved that the lower two discs are the problem. And when was the surgery?
1 month ago today.
And we did that minimal invasive interbody fusion, that OLLIF procedure for you. And we just were looking at the data. The surgery took me 69 minutes from skin to skin. Obviously, you were in the surgery a little longer. But then, how long did you stay in the hospital?
2 days.
And then you walked out of hospital?
Oh yes.
Okay, and tell me about your symptoms since the surgery.
Well, it kept getting better and better. I could move around a lot easier, and my feeling in my legs and feet started to come back, which kept me. When I used to fall down a lot, so after having that, I don't fall down anymore.
Okay, now the pain was, you told me 8 or 9 before the surgery. How bad is the pain now?
Yeah, 2, 3.
And what about the leg pain? How bad was the leg pain before and how bad is the leg pain now?
It was very bad. I couldn't even feel nothing.
Okay.
And
So 8, 9 as well, the pain in the leg?
yeah,
Maybe? Okay, and now the pain in the leg, how bad is it now?
yeah, 2, 3.
Okay, now I want to show you something. And you had something we as well cause spinal, radiculopathy. And that means that the hole here on the side here, where the nerves are coming out, was very narrow. And that was part of the problem pushing on the nerve. And many people say when something like that happens, you have to go and literally cut this bone here and here, do what we call facetectomy or foraminotomy to open up the nerve. But we, with OLLIF, what we do instead of cutting the bone, we put a spacer in that increases the distance between the bone, and that actually opens up. We call it anatomical or physiological decompression. And as you see, in your case, it's working. And here we see that 2-level L4 to S1 OLLIF. And practically what it enables people to take the pressure off the nerve without cutting the bone and the muscle. Now, you told me as well something about the skin that you were surprised there are multiple smaller incisions. Obviously, we did one incision to put the cage in, but for each of those screws, we have to have a small half-inch incision to put them in. But as well, many people think the minimal invasive part of the surgery is the skin incision, which is not true. The minimal invasive part of the surgery is that we don't have to cut the muscle and the bone underneath the skin, and that's why people recover much faster. Now, overall, how have you been happy with the result of the surgery so far?
Oh, I've been extremely happy with it, and yeah, like I was saying, it was like nothing short of a miracle that I could walk again without
Excellent.
falling down.
Excellent. Now, obviously, this bone needs about a year to grow back together. In that time frame, you have to just, keep your back stable and give it time. But overall, I think we are on a very good path. And this video is just to demonstrate that indirect, what some other people call indirect decompression, we call it anatomical decompression, is extremely successful as well to provide relief of the pain in the legs, what we call radiculopathy. Well, thank you for your interview. I appreciate that.
Okay,
Thank you.
Thank you.